Hello, my name is Haley Abgoff, and I'm the first author for the paper Barriers and Facilitators to Breastfeeding Support Practices in a Neonatal Intensive Care Unit in Colombia. My co-authors on this paper are Dr. Catalina Ochoa Marin, Dr. Sonia Semenik, and Dr. Isabel Cristina Arellave. This project was conducted as part of a nursing collaboration which was developed between the Ingram School of Nursing at McGill University in Montreal, Canada, and the Faculty of Nursing at the University of Antioquia in Medellín, Colombia in 2012. In 2013, the World Health Organization's Baby Friendly Hospital Initiative was expanded into a new international program called the Neo-BFHI to address the special breastfeeding support needs of preterm and ill infants hospitalized in NICUs. The Neo-BFHI includes 10 steps to successful breastfeeding and 3 guiding principles which focus on the mother's individualized needs, providing family-centered care, and ensuring continuity of care from prenatal to post-discharge. A previous study conducted in 2014 as part of this nursing collaboration explored NICU nurse perceptions of parental readiness for discharge at Hospital Universitario San Vicente Fundación in Medellín, Colombia. Breastfeeding challenges such as difficulties maintaining milk production and mother-infant separation were identified as important concerns. These findings led to a larger quality improvement initiative to enhance breastfeeding support in the NICU guided by the Knowledge to Action framework. The first step in the Knowledge to Action cycle involves identifying the gap between evidence-based recommendations and actual clinical practice. The objective of the study was to explore breastfeeding support practices and related barriers and facilitators in the NICU at San Vicente Fundación, guided by the Neo-BFHI's new international guidelines for breastfeeding support in neonatal units. A multi-method descriptive design was used. A retrospective review of 51 medical records was conducted to obtain baseline data on breastfeeding-related practices and outcomes in the NICU. A key informant group interview was held to complete a Spanish version of the Neo-BFHI's International Self-Assessment Survey of Policies and Practices to protect, promote, and support breastfeeding in neonatal wards. Finally, to validate the questionnaire responses, 3 observational visits to the NICU were completed using an observational checklist adapted from the Neo-BFHI guidelines. Of the 51 infant charts reviewed, 98% received their mother's milk at some point during their hospitalization, and 96% were fed directly at the breast at least once prior to hospital discharge. However, at time of hospital discharge, only 10% of the mothers intended to exclusively breastfeed. The Neo-BFHI self-assessment questionnaire identified many local facilitators for breastfeeding success in the NICU, in addition to several barriers to breastfeeding support that could be targeted for quality improvement. The World Health Organization's assessment process for baby-friendly accreditation recommends using multiple sources of data to assess compliance with the BFHI. Several discrepancies were noted between the questionnaire responses and infant feeding practices. Integrating such key clinical indicators into the unit's documentation systems would facilitate data collection for ongoing quality monitoring and benchmarking of breastfeeding support practices. Finally, I would like to extend my thanks and gratitude to the whole NICU team at the Hospital Universitario San Vicente Fundación. They played an integral role in facilitating and supporting this research project.